And we're back. So, hey, Sheldon, thanks for coming, man.
No problem, man.
So, it's been good to get to know you over the last, how long have we been, in full disclosure, like
At least
clients?
14 days.
Yeah. And I feel like we're already solving the world's problems over a cocktail or two. I mean, how many locations have we been in just because the trade show circuit is back?
It is back.
We were just in Charleston, what was that, 2 weeks ago?
And now we're back in Becker's,
Here
Chicago.
we are. So thanks for joining, man. Really appreciate it. So as you know, RCM Innovators, this is our new series. We're talking to clients and prospects and industry leaders in general, really trying to get inside people's heads around what they're excited about, what they want to get done from an innovation or market disruption standpoint. So we'll just start with that. Like, what are you excited about right now as it relates to kind of AI, machine learning, or?
So for me, I'm excited where the industry is going with it. So as you notice, the trend over the last couple of years to me, AI was just like kind of like a buzzword.
Right.
I didn't think we really had AI in healthcare because we didn't have information. Now we're starting to get the information, so now it's starting to become more relevant to us where the AI can actually start proving to be more predictive analytics versus just telling us what we've done in the past.
Yep.
And in the past, I wouldn't say other companies, but historically, what would happen is that these companies would come in and say, oh, we have AI, and all they're doing is giving you a pivot table of your same data.
Right,
and saying,
sure.
look, we
Screen
found this.
scraping.
And I'm like, guys, not really AI, because it doesn't really help me make decisions. It just tells me what happened. I think healthcare now is looking more towards the future and being a lot more predictive than we were in the past.
Yeah. By the way, I got so excited. Tell our viewers, you're Sheldon Pink, and where are you from?
Sure. I'm Sheldon Pink. I'm the VP of Revenue Cycle at Lumina Health.
Yeah.
Lumina Health is a community health system in Annapolis, Maryland.
Yep.
And we are focused on basically increasing access to care to all our patients in our communities.
Yep. So, again, you know, as it relates to, what are you trying to get done in the revenue cycle over the next couple of years? Like, what is success to you if you go a couple of years out?
So a couple of years out, success would mean establishing revenue cycle excellence within my organization. Historically, the organization has, because we were a GBR state, global budget revenue state, I think the hospital system didn't really look at it prior to the arrival of my new CFO and myself. They didn't really look at it as a revenue cycle. They looked at it as more of a reimbursement function. So when we got there, we had to kind of build up revenue cycle and build a framework for it.
Right.
So if you ask me what I'm looking for in the next couple of years, I think we've established a framework. We started to get some technology in there, some tools. So for me, success in the next couple of years would just be establishing a true revenue cycle presence within the organization and hopefully setting a state standard.
Yeah. And you know, we talked about, as we've been getting to know each other, like, I'm always curious, like, how do you get things done inside your organization? And everybody has, you know, corporate dynamics and inertia and headwinds. So when you're tackling big things like innovation or disruption, what's your methodology? You guys incremental? You kind of go big bang? Like, how do you get things done?
The first step is to understand the organization. There's some organizations that operate in silos. Our organization does not. Our leadership team is very involved, and we want to make sure that when we get together, we have an organizational approach. We hear the voice of everybody within the organization, whether or not it affects you or not. It's just needing to understand, right? And that's kind of the team culture even our CEO brings down on us. That being said, when we approach projects, it's very methodical. Some projects you can do very big bang, some you can do incremental. The technology projects that we have explored right now, we're pretty much doing it as a big bang. We want to make sure that we can get these things up and running because they have their investments for us, right? And the only way we can get the true value of our investment would be to get it up and running. So, you know, we get the teams together, we align the organization, we work with IT. IT has to be our partner because clearly they're the one, they have the keys, right? Keys to drive the car.
Collaborate for sure,
And then we set up project management, and that's the biggest thing with being successful in doing any kind of big bang or any kind of project, no matter big or small, is the project management piece of it. And I've created positions within my organization that help manage those different projects. You've spoken on a couple of them.
Yeah.
Kimberly Ward, for instance.
Yeah,
right?
That's a really good point. I will say that you guys invest in project management on your side, and that doesn't always happen.
Correct.
So that the fact that when you take something big like how we're working together, and you're investing that central project management, right? So we have two single points of contact that are,
Correct. Everything to me has to be a project,
Yeah.
right? It's because without it being a project with deliverables and timelines, you don't really get it done, and you don't have any accountability.
Then it's bagel meetings, right? And
Correct.
hallway conversations.
It's like, oh yeah, I was going to get to that, but I wasn't sure who was supposed to do this. So I think that makes it a lot more structured.
Yeah.
And set you up for success.
Yeah, awesome. We have been talking a little bit at the bar about pop health, and in a kind of a provocative way, like, are we ever going to get this done? Because we all know that payment transformation is needed, and that aligned incentives should directionally go towards value-based care, but it's tough. It's tough to bust through the rhetoric, right?
Correct.
But in your unique situation, being in Maryland, I think you've shared that there's an opportunity specifically with, you're almost like a guinea pig in a way.
Correct.
Right?
We're the test dummies, right?
Yeah, yeah.
So I look at pop health as like a triangle, right? You have to think about the patients,
Yeah.
the health system themselves,
Yep.
being prepared, and then you also have to figure out the regulations. So let's start with the regulations,
Yeah.
right? To get to true pop health, we're going to have regulations that kind of make sense. And
Right.
the problem that we're having today is that the people making those regulations, they're not in healthcare.
Yeah.
Their intentions are
Washington
good.
bureaucraats creating the rules that we
Their
have to live
intentions
by.
are great, but they need help. I think they should start putting healthcare people at the table
Yeah.
so that we can make better decisions. I mean,
Yeah.
an example would be like the No Surprises Act, right? They put that burden on the hospital to tell the patient what they owe, but in theory, wouldn't the insurers actually have a better accuracy because they can see where their patient is going and where bills are submitted from,
Right.
right? So it's kind of like, the intention is good. The patient should know.
Yeah.
The other part of the triangle, the patients themselves.
Yeah.
Patient education. Our company is very big on educating our patients and making sure that they know they don't have any surprises. They understand their bill. I mean, we've put out a lot of investment in digital communications and language to help support, patient understanding. Patients have to feel comfortable coming to the hospital to access care.
Yeah.
Right? So part of that population health is the patient has to feel responsible and feel like they can come and get care without having a financial burden.
Yeah.
So in Revenue Cycle, we try to make sure we manage that patient's financial experience and make it an overall good experience for the patient. And on the third part of the triangle is the hospital and the health systems. They have to do service line alignment. They have to make sure that they're constantly engaging in their community to make sure they're offering the right services to support the community.
Right.
So then, and in Maryland,
Sure.
that's how we're incentivized. So we do a community assessment, a needs assessment, and then we start saying, all right, this hospital, for us to serve our community better, what we need to do is have this service line versus this service line, maybe come down on this and bring this
Yeah.
up a little bit. But those three things have to constantly be in motion for us to truly succeed at population health.
And so where's the role of technology inside that triangle, right? Like things like kiosks and...
Oh, it's all in the middle of the triangle.
It's in the middle,
because that's
right.
how we stay connected, right?
Yep.
We're an Epic shop, so
Yep.
part of it was, ensuring patients are using their MyChart, and making sure a lot of physician practices, a lot of hospitals are on Epic, documentation within the system, that helps support. And I think Maryland has CRISP, I believe, which is also
Yep.
statewide healthcare medical record. And that's the direction that we have to go in to really ensure population health.
One of the conferences that we were recently at, somebody gave a talk, and simple question like, all of us that when we become patients in healthcare, You know, whether you're going for your physical or you're having some lab work done, you're in the ER. Why do we all still have a clipboard?
Why do we still have what? I'm sorry?
Why do we still have a clipboard? Like it's uncanny to me, all the technologies you just mentioned and kiosk, but when you go, they still hand you the clipboard. And like, haven't I given you this like 100 times?
I think people are really comfortable. People are not always as comfortable with technology as they as they make it appear to be. So we like to get the new tools, right? And I experience it even in my organization sometimes. Everybody wants the new tools, the new this, the new this. They want to be innovative, AI. And then you say, okay, guys, now I really need you to use the system. They're like, oh, get rid of my paper. That paper is just everything to somebody. They feel like that's their record.
Yeah.
And culturally, it's just something you have to kind of slowly get out of. You know, I try to get out of using paper as much as I can. I'm like, guys, scan it. You know, put it on your digital drive. Do anything like that. But it's slowly adapting behaviors to use the system versus the pieces of paper.
Yep. So go out 2025, and what have you gotten done in terms of your projects?
I think hopefully my VisiQuate implementation will be done.
I hope so.
I think in 2025 it's just really, for us, is the typical understanding your denials, getting it down, and it's being able to combat your problems quickly and identify them much easier. I think that's the name of the game. In the revenue cycle, we exist because there's always going to be problems.
Yep.
Right? The goal is how quickly can we adapt to those problems and solve it.
Yep.
So my goal in 2025 is to make sure that we can identify and solve problems in rapid fire mode. We shouldn't have to wait until something exacerbates itself and then be like, guys, we have a $4 million problem out here. What do we do? Right. It should have been like, we caught this, we started seeing the trend when it was 200,000 and 300,000. And here's how, and we know how we're going to fix those problems.
Yeah.
It's like, we have our denial committees, we have our technology committees, you know, we know what our system can do. So for me, it's really getting that framework to understand how we resolve problems, because we know they're always going to exist.
How much do you think, like if you look at the pandemic and work from home, and a lot of folks, you know, not everybody's coming back. Some people looked at quality of life issues, the so-called great resignation. Are you guys experiencing that? And
absolutely.
What percentage of your technology and innovation has to be to just fill that gap? Like digital workers is a good idea, but in some cases when we talk to clients, it's a necessity, because it's like 20% of my workforce ain't coming back.
So it plays a major part, and that was part of some of the investments that we had to make over the last year at Luminis, because we did have part of the great resignation. You know, I think my CBO was running about 15% understaffed for the entire year. So we had to become more creative. You know,
sure.
It's always when your back is against the wall. That's what drives innovation, right? And then part of being creative is understanding what your true needs are. And we had to go through that process. All right, we know these workers aren't coming back. You know, we have spacing issues. How do we get the best bang for our buck? What do we really need? And every hospital has different problems. You know, my math might not solve your equation, right?
Right.
But what we need to do is take the time to assess it and say, all right, here's what we need in the future. For us, what we needed was automation. We needed reporting, right? And we needed process and standardization. So we started focusing on those things, and then now, and getting out of paper.
Yeah.
Paper was actually a bigger problem than I thought. We saw people who had jobs that they were still printing things. And I'm like, why are we printing?
Yeah.
So just understanding those processes and saying, the system can do this, guys. We didn't allow the system to do it.
Well, I was sitting on a panel not too long ago, and they were talking about, you know, the silver lining in COVID, or several use cases, one being telemedicine. And part of the question was, why were all of us on a journey? Why was it going to take 5 to 7 years to do this? And it's like, well, because that's what we do in healthcare.
Your back
we love the journey, but when, like you said, when your back's against the wall, it created an opportunity where it's like, you know, we got to solve this problem now.
And that circles back to your question about the Big Bang.
Yeah.
And that's one of the reasons why I like that Big Bang approach, because if you give people time, time is endless to some people. And you say, oh, let's do it incrementally, little by little, it'll never get done.
Yeah.
You say, we're getting this done.
Yeah.
We're going to do this, all hands on deck. We have to start other projects.
Yeah. It's the Band-Aid, right? Sometimes you just got to rip it off and go for it, right? There are certain...
Exactly. It's an excuse sometimes, too.
Yeah,
you know,
sure.
It's, exactly, you just said it. Why did it take so long to get telemedicine up and running? We had the technology. It was always there.
Yeah.
It wasn't a technology gap. It was, well, let's think about this.
Yeah.
Then when we had to do it, it was like all of a sudden we were up and running with telemedicine in like 60 days.
Yeah.
The whole nation.
Yeah.
60 days.
And how is that going now? Like, what have you learned from that? And how, are you guys getting paid? I know some people are still struggling to cover the costs.
Yes. So we're still getting paid, but the reimbursement is less.
Yeah.
So it changes your model a little bit, right? And some physicians still have some qualms about it, where they feel like they're not physically seeing their patient.
Yeah.
And there's still
some
technology challenges
hands-on,
at
right?
home, right?
Yeah.
You know, we still have people who fight and get on Zoom meetings.
Yeah.
You know, and we've been doing this for like 2 years, right? So it has its positives and it has its negatives. However, I think it's here to stay, and it's going to be the social norm at some point.
Yeah. What about you know, with your workers? Are you guys? What percentage of your workforce is still working from home? Are you doing flex?
Well, if I had to put a percentage on it, my team is hybrid, right?
You're a hybrid model, yeah.
Right. So everybody comes in on certain days, and I personally like that camaraderie that you can build with the team.
Yeah, sure. I'm big on that too. Yeah.
But I do have some workers who are fully remote. The hybrids, they come in 3 days a week.
Yep.
We have some fully remote individuals, not a lot, and of course, patient-facing. There is no hybrid.
Yep.
You're patient-facing, so you got to come in.
Yeah, absolutely. Yeah, front office. How do you think about like gamification as a way to, you know, incent people?
I love it.
It's hard enough, right? That
So I've been an advocate for gamification for the last about 4 or 5 years. I went to a conference and HR. They had the HR presence there, and they, you know, kind of walked us through it.
Yeah.
It is like ultimate team building.
Yeah.
You know, and it makes you know your team at a different level. Sometimes I don't want to know my team member just on the report that they give me. I actually want to know what drives them, what makes them wake up in the morning.
Sure.
And a lot of gamification efforts helps you understand that about your employee, and it also helps you choose the right team members. The skill set is not always the right fit.
Yeah. Yeah.
There's a personality blend that has to be a part of it as well. And when you understand your team members, it helps you interview people better because you know what your team is looking for.
Yeah, I feel like we have to get more surgical in exactly what you just said. What are their dynamics? If you've got a single mom with kids and school and soccer practice, like we should be working within those constraints.
Correct.
Especially if they're high performers versus like traditional time and attendance. So it's that multi-dimensional, multivariable, you know, calculus in a way.
Exactly, and it's needed, right? Because you talk about the Great Resignation. It's now individuals aren't really worried about how much they get paid. They want to love their job. They want to be able to want to come to work. So, as an organization, you know, we have to try to make our team members feel welcome and wanted. So it's really going to be the trend that's going to create a standard for us in healthcare, in any industry, to be fair.
Absolutely. What have I not asked you that I should be asking you? Like,
well, you haven't asked me my shoe size yet.
What's your shoe size? Bigger than mine.
I guess to that question, I would say you haven't asked me all the good things that we're doing at Luminis.
Okay. So talk to me, Goose.
So we've focused a lot on patient engagement. We really go out in our community. One of the reasons why, I mean, I would say the organization chose me, but I chose the organization as well, was because of how they treat their community. And that was one of the things, you know, in my travels, I've been to other health systems that I felt like they were doing the job, but they didn't really have that community outreach.
Yep.
And at Luminis, we have that community outreach. I can honestly say our leadership from the top down really loves our community.
Yep.
And does everything they can to help support it.
That's awesome. Like, but how do you go about that? I mean, that's a multi-pronged, like omni-channel strategy, right?
Right. Well, we have teams that are always looking for our community needs. What is our community needs? What are our patients saying? Like we really value what our patient. If we have a patient complaint, it's a big thing. It's not like, oh well, maybe this patient just had a bad. No, it's a big thing. Like, guys, what did we do wrong? And then we're all in a room trying to figure out how we can fix it and make sure it doesn't happen again.
Yeah.
We're constantly trying to increase our access to care for patients. Anything that we can do, any new technology, any strategy that we hear other people doing across the country, we'll implement that and test it out in our market just to make sure that we're giving our patients the best value that they can possibly receive.
It sounds like a little thing, doesn't it? But that's a big thing.
It is, because sometimes you get focused so much on, as a health system, so focused on your bottom line, you're not really seeing how your energy towards your profitability margin, what you're not doing for your community.
Yeah.
And at the hospital we're profitable, and we're able to do it, right? So it's part of our game plan.
Yeah, to me it's like what we need to be. It's the classic no margin, no mission.
Right.
We need margin and we need innovation to help take all of these dollars. We got to move the needle in yield and move the needle in cost so that we're putting that money. We need to fund those things so you guys can do that, because that's what the patient wants. Right? They want those dollars either going to the care itself and everything that surrounds the care, right?
Exactly.
I always like that idea of a patient is sometimes a customer. They're a customer when they're shopping for their care, and then they become a patient when they're in their care setting, right? Then they also become a customer when you send them that billing satisfaction survey.
That's right.
Sometimes we just focus on the clinical aspect without thinking about the retail side of it.
And we have to, because a patient's financial experience can be just as worse as their clinical experience, and you don't want that negative stigma on your health system, right? So we all have to do our part. We trust our clinicians to get the best care, and the clinicians in turn trust our finance team to make sure we provide the best financial experience for our patients.
I don't think we can end on anything better than that. It's all about the patient. Hey man, thanks for really appreciate it.
No problem,
thanks for
man.
joining us today. Have a good rest of your show.
I'm gonna try my best.
I know you got a busy agenda the next 2 days.
Yes, very busy.
All right, my man. Thank you.
Have a good one, man.